Hello, everyone. My name is Dr. Damian Heiser with Bodyworks Physical Therapy and Concussion Center, and we wanted to speak a little bit and bring this video to everyone today to talk about the number one most common reason why people walk through our front door as a physical therapy clinic, and that is pain. Pain is the biggest driver. It's the biggest reason why most of our patients, most of our clients, really most anyone comes to see us or another healthcare provider, right? It plagues almost every single living person, almost every single day. Yes, there's tons of differences as to why people are experiencing that, and we wanted to talk a little bit more about pain today, but specifically a very certain type of pain, and this type of pain I'm speaking to is what we term chronic or persistent pain. And you might be thinking to yourself, well, what does that mean? What does chronic pain, what does persistent pain mean? And to sum up these kind of two definitions succinctly, persistent chronic pain is pain that is no longer associated with a normal tissue healing time frame. And we're having symptoms, we're having pain that's presenting past where we would expect that healing to have happened and already occurred. So, for example, really common injury that a lot of people sustain throughout life, an ankle sprain, right? You roll it, it hurts, it swells up, maybe it bruises, and that lasts for, I don't know, a few weeks, right? Naturally, for most people, that tends to heal. Sometimes you need a little bit of help with that, but we tend to get back to where we were within a couple of weeks, and most of the time we don't really have pain beyond that. Now, let's say that total time frame is about 4 weeks. In about a month, you're back to normal at that point. Well, now let's say after that 4 weeks, your ankle is healed. It's no longer swollen. It's no longer bruised. It's able to move around the ways that it needs to, and you're able to use it the way you need to get around every single day or play your sport. But let's say you're having the same kind of ankle pain you were having when you first sprained it, or maybe it's gotten even worse, and maybe it's spread a little bit. And even though things have healed, it's still hurting a whole bunch. That's kind of what we mean when we talk about this chronic and persistent pain. And most of the time when we see these presentations, this is something that's lasted for over 3 months. And for a lot of people that we help, this is something that's been going on for 1, 2, 5, 10, maybe even 20 years sometimes. I've treated a lot of patients where we've been working through some pain where they've dealt with this for over 10 years. So it's very common, and I wanted to talk a little bit more about that today. And to do so, I have some illustrations to help me out. So bear with me as we go through this, everyone. But as everyone knows, we have nerves in our body, right? We have what we call the nervous system. And there's always this activity that's going through our nerves every single day, whether you're sleeping at night or whether you're doing a really intense workout session. And for most people, most of the time, we all kind of live and exist at a very baseline level of activity in our body and our nervous system here. And if you look at this graph, on the x-axis here, you're going to see time. And on the y-axis, you're going to see intensity of, let's call it intensity of stimulus, okay? And at the very top, you're going to see a dotted line there. And what that dotted line represents is enough stimulus to start to have our body experience pain at that point. So as you can see from this first graph, this is us at baseline. This is me just sitting here right now. A very low level of activity. I'm not having pain and I'm not having problem. I could sit here for a long time and be just fine, right? Now, everyone kind of think with me a little bit here, use our imaginations. Let's say we go outside and we're walking down the sidewalk here, walking through a construction zone, and we step on a nail. Well, now what's going to change to that graph we just took a look at? Again, if we take a look at this here, we see we're baseline pain, boom, we step on the nail and we shoot way up beyond that pain threshold. There's enough stimulus for our body to now experience pain. It's trying to protect us, it hurts, there's a nail in our foot, we shouldn't really be walking, running, jumping on that, right? And so what do we do most of the time? Well, we get that taken care of, right, for most injuries. So using this nail example still, maybe we go to the doctor, the hospital, whatever they may be. They take the nail out, they use some antibiotics or some other medications, and over time, right, we're in this painful experience, painful stimuli, but over time, that should start to decrease, and decrease until after a few weeks, we're back to that baseline level of activity in our body, baseline level of stimulus to where we're not experiencing pain. We can go and walk, run, jump, hike, whatever it may be, use that foot that we had the nail in and not have a problem at this point. Now, let's say that after that period of time, maybe it's 2 or 3 weeks for that injury to heal, rather than going back to that baseline level of pain, as you can kind of see here, we stay up in this pain experience. We drop back down below that threshold of having pain, but we don't return all the way to the baseline level here. And if you kind of appreciate the room, if you will, from baseline to where we start to experience pain, there's a lot of room. For most of us, we can do a lot of things before we start to hurt. But if you look where we're at now, there's a lot less room. We can only do so much before we start to experience pain. For this example of the foot, maybe we're only able to walk for 2 minutes and then our foot starts to hurt again. And maybe that pain is kind of spread around a little bit here to our ankle or our calf or our shin or something resemblance of that. And if we go beyond this and if we really think about, well, what are the most common problems we see with persistent pain? Back pain is probably the number one thing. This is where someone's had a back injury and then months have gone by, maybe years, but now they aren't able to bend forward to put their shoes on because it hurts, or they're not able to lift the weights they used to or be a part of activity and exercise the way they were used to. Because the ability for them to do those movements or do those exercises is so much smaller because their pain gets brought on so much faster. And what tends to happen with these individuals where we are going through this persistent pain process is now, instead of coming back down to a baseline level, we kind of hang out at that just below the pain threshold level, and multiple times throughout the days, weeks, months, and years, we just kind of keep going up and down. I call this the roller coaster effect. We keep roller coastering up and down into pain and out of pain. And we never really get to a point where we ultimately feel comfortable, we feel safe, and we feel like we can do the activities, movements, exercises that we love. And guys, this is super common. About 1 out of every 4 persons who experiences some sort of injury, especially things like back pain, neck pain, shoulder pain, will go on to develop these persistent symptoms. And this is something that we work with every single day. These are patients that are near and dear to our hearts as physical therapists here at Bodyworks Physical Therapy and Concussion Center, because we know and we understand how disabling, how frustrating, and how problematic this presentation can be. This is where people have gone and seen multiple providers, whether that's physical therapists, chiropractors, physicians, alternative medicines. They've maybe tried a surgery or 2 or maybe even 3 to try to resolve this problem with the thought and hope that, hey, we found maybe some issue, something looks a certain way on my x-ray, CT scan, or MRI. We're going to go in and we fix that. They come out of surgery and things either are just a little better, they're no better, or we're hurting worse than we were before we even had the procedure. And now we're kind of stuck in this rut of, man, what is going on and what do we do? And I have news for everyone who's maybe watching this, and that there is hope. There are things that we can do. We can get back to a more baseline level of activity before we have pain, and we can most importantly get back to putting you in control of your life and in control of your symptoms and returning to things that you love and want to do, rather than having your pain and your symptoms be in the driver's seat of your car while you're trapped in the trunk kicking and screaming trying to get out of there. Let's take you out of the trunk and let's put you back in the driver's seat of your life here, everyone. So if this sounds like you, someone you know, or someone you love, let them know. Reach out to them, send them this video, and feel free to reach out to us at Bodyworks Physical Therapy and Concussion Center or another trusted healthcare provider. Our information will be in the details below the video, but you can find us at info@bodyworksphysicaltherapy.net for an email address. Bodyworks Physical Therapy and concussioncenter.net is our web address, and our phone number is 316-558-8808. And yes, we do still love to talk on the phone. So even if you're skeptical, have questions, or just need to be heard a little bit more before being seen, we'd love to chat with you. So everyone, thanks so much for joining me today and talking a little bit more about pain. Again, if this sounds like you, reach out to us. Let's see how we can help. Thanks so much. Have a great rest of your day. Bye-bye.